everybody. Today we're going to be talking about the lateral collateral ligament of the knee. So as some of us may know, we have 4 ligaments of the knee. This front part here is known as the patella. This whole thing is the patellar ligament. And then over here on the inside you have your medial collateral ligament. And on the outside, what we're going to be focusing on is the lateral collateral ligament. And then on the inside of the structure, it's a little hard to see, but you have your posterior cruciate ligament and the anterior cruciate ligament. These all play a major role in this whole overall stability of the knee. And like I said, we're going to focus on that lateral collateral ligament over here. As far as it being injured, there are several mechanisms of injury. A big one is a varus force, which is kind of like a blow to the inside of the knee, and it will actually cause the knee to go like this. As you can tell, it stretches out that ligament a little bit. And it happens most commonly in contact sports. It can also happen in non-contact sports too, or in just general, right? It can be soccer, hockey, football, sports like that. It's actually pretty common in skiers too. And yeah, I think that's about it. So Dan over here, he's going to be completing what a normal physical therapist would do with a patient when he's suspecting an LCL sprain. I think it's important to remember there are 3 levels and grades of sprains. A grade 1 sprain, there's no tear in there, it's just a mild sprain. There's no laxity in that ligament. A grade 2, it's a partial tear, and then a grade 3 is considered a full tear. And usually in a grade 3, in those cases, those require surgery, so we might not see those too often in our clinic. But Dan will take it over from here and go through the presentation.
So Jess is our patient here. She is experiencing a grade 1 LCL sprain. So what we would see for clinical presentations is the first thing we would see a little bit of swelling on the outside of the joint line, more or less with a grade 2 than a grade 1, but there will be some minimal swelling. The second thing is we want to palpate the lateral joint line for that local tenderness and pain. Another thing we'll see is a lack of range of motion in extension and flexion at the knee. Another possible presentation we could see is discoloration of the skin. So this is called ecchymosis. This is when there is bleeding underneath the skin, so you may see some discoloration on that lateral joint line. And the other thing that you'll see is maybe some possible paresthesia down the lateral leg, maybe even into the lower lateral ankle and the dorsum of the foot. Now we're going to take a look at Jess's functional gait pattern, see if there's any maladaptive movement patterns with her walking. So Jess, I'll have you walk down the hall here. So what we'll notice here is that Jess is spending a lot less time on that affected side, and that's just due to that instability of the knee. It's more of an apprehension to putting weight bearing through that left side. All right, so the next thing we're going to do is we're going to do a special test called the varus stress test. What this is going to do is it's going to look for instability on that lateral side of the joint where the LCL is located. So to perform this test, I'll lift the leg up this way into full extension of the knee. I'm going to add a varus force at the knee. To isolate the LCL from the cruciate ligaments and the IT band, we're going to put the patient into 20 or 30 degrees of flexion at the knee, and we're going to add that same varus force. What we can also do is externally rotate the tibia in order to put more stress on the lateral side of the joint, and do the same thing with the test.